Why is acoustic reflex testing important in tympanometry? Imagine trying to understand how well your middle ear is working, not just by looking at the eardrum but by seeing how it responds to sounds. That's exactly what acoustic reflex testing adds to tympanometry. While tympanometry measures how freely your eardrum moves when air pressure changes in your ear canal, acoustic reflex testing looks at how your middle ear muscles respond to loud sounds. When a loud sound is played, a tiny muscle called the stapedius contracts automatically, stiffening the bones in your middle ear. This change affects how sound travels through your ear, and we can measure that change. This testing is important because it gives us more detailed information about your middle ear health and the neural pathways involved in hearing. For example, if the reflexes are absent or abnormal, it might mean there's a problem with the muscles, the nerve pathways, or even the nerves that control hearing. It can help identify issues like nerve damage or neurological problems that might not show up on regular hearing tests. Acoustic reflex testing also helps us understand whether your hearing loss is due to a problem in the middle ear or somewhere deeper in the auditory system. If tympanometry shows your middle ear is normal but reflexes are missing, it could point to nerve or brainstem issues rather than a mechanical problem. This is especially useful in diagnosing conditions like retrocochlear disorders, which involve the nerve pathways beyond the cochlea. Another key benefit is that acoustic reflex testing is usually done right after tympanometry, using the same equipment. It involves playing loud sounds at specific frequencies and measuring how your middle ear responds. This helps ensure the most accurate results because the middle ear is at its most compliant state during the test. Plus, it can detect early or subtle issues that might not yet affect your hearing thresholds. For instance, it can reveal early signs of nerve damage or cochlear na, which is damage to the connections between hair cells and nerve fibers. These issues can cause hearing difficulties in noisy environments even if your pure tone hearing test looks normal. Overall, acoustic reflex testing is a vital part of a comprehensive hearing assessment. It provides a functional look at how your middle ear muscles and neural pathways are working together. This information helps audiologists and ENT specialists make more accurate diagnoses and decide on the best treatment options. If you're concerned about your hearing or middle ear health, always consult a healthcare professional who can interpret these tests in the context of your overall hearing health.